What a great opportunity for us. We are very pleased to be able to be led by an extraordinary executive. Our president and CEO, Neil Moore, is guiding us through a lot of innovation in this growth opportunity. So Neil, I'd like to get the program started with you if we could.
Thank you, John, and good morning. I'd like to say this is another great day in Prince George's County, another great day in the Suitland community, and a exciting time at Dimensions Healthcare System. But more so, it's about the residents here in Suitland and the neighboring community that will most benefit from what we're doing in promoting primary care, ambulatory care services. I'd like to thank our partnership with Prince George's County and the Health Department, as well as our county executive, because if it was not for him, this could not have been made possible with the providing primary care, obstetric services, as well as dental services, along with his team that I've worked with over the past year in order to get us to this, this time. You may recall that the University of Maryland School of Public Health impact study that was released in July 2012 actually pointed to some concerns about the lack of primary care services within Prince George's County. As a matter of fact, I believe the study talked about a shortage of about 61 primary care physicians and 32 dentists within the county. So this is one small step, but a giant one, I would call it, in addressing the needs outlined in the report for expansive, comprehensive, good quality primary care services in this community. I recall some of the initial discussions that we've had with Mr. Seaman, Mr. Himmler, Ms. Hager Francis, Councilwoman Tolles, and the health officer. We all had the same high degree of passion for making this collaboration a reality. It was perfectly aligned with Dimensions' strategy to expand primary care and ambulatory care services in the new healthcare era of population health within our county. So this Family Health and Wellness Center is just the beginning for us. We hope to go further. Right now you've seen the launch of Dimensions' ambulatory care strategy and the foundation of an integrated healthcare network as we work towards developing the new regional medical center, which will connect all our primary care centers. We will continue to expand. We will continue to be responsive to the communities as an institution here providing healthcare services. I'm sure you can imagine that getting here took a lot of work. It's a lot of people that were involved operationally in getting us to this point. And at this time, I would like to take a moment to publicly thank all the staff who were responsible for working tirelessly on this initiative. Started with a financial plan to our physician arm of the hospital, Dimensions Health Associate, known as DHA, which is led by Michael Jacobs, the president, and all the support staff that actually work on this initiative. I would also like to ask the staff that have been, staff members whom have been identified to work here at the Family Center to please stand, all the staff members, and wave so we can see you. Like I said, this is just the beginning of a great medical team. I'm sure that as our patient volume grows, our staff and services will grow to continually meet the community needs. Yet, I do commend those who are willing to be first, you the staff members. We do anticipate that with healthcare reform and with more covered lives, we are bound to see more patients and a growing number of patients in our health centers, including this one. Healthcare is people business, and we need to be where people are, and that is coming directly to the community. Speaking of our community, this is a perfect time to say a special thanks to a very passionate person I have had the opportunity to talk with on numerous occasions and who have actually pointed out to me many healthcare issues, from diabetes to hypertension to obesity to nutritional services, just to name a few. I'm speaking of a friend and Suitland's district leader, the Honorable Karen Tolles, who serve on Prince George's County Council representing the citizens of Suitland and many others in District 7. Again, I want to thank you for joining us this morning, and thank you for your support. I now am honored to introduce Councilwoman Tolles.
Good morning, and thank you. Can you all give Neil Moore another round of applause? He is so great. Yes, I have considered Neil a friend. Neil, Mr. Neil says, I got to come and tell you what's going on over here in Dimensions. And that's important because while he may, be the president and CEO, I appreciate the way that he reaches out to my office and many of my colleagues to talk about the great work that Dimensions wants to do right here, not just in Suitland community, but Prince George's County, because it's important that, folks understand that we are all in this together. So thank you, Neil, for being a friend, and thank you for the consistent communication. Thank you. I also want to actually take a moment to thank, I know the county executive would do it as well, but I have to thank Betty Hager-Francis as well, and Pam Creekmer. Can you give them both a round of applause for the great advocacy and work that they do to make sure healthcare in Prince George's County is top notch. And I know family services folks are here. Are you going to shout out your staff? Because I don't want to have to do your staff. Okay. I also want to take the opportunity to ask those individuals that are part of the community here, because that's who I serve. I serve the people of District 7 and the people of Prince George's County. So all those individuals from the community, can you stand? I saw the mayor of Suitland, Elsie Jacobs. Stop hiding and stand up. Mayor, stand up. And all those that live in the community, are you here? Stand up if you live in this community or in District 7, because this is for you. Today is for you. Today, Prince George's County, County Executive Baker, County Executive, not County Executive Toll, Councilwoman Tolles. We are bringing services, and the entire Prince George's County government is what I was trying to say, are bringing services right here to you in Prince George's County. So this is for you. Let's give our community folks a round of applause for being here. You can see seated. And I certainly would be remiss if I didn't take the opportunity as Chair of Public Safety to recognize the great work that our officers are doing. Major Murther and Officer Tyler, I see you out there. Please stand. I saw you. Wave your hand, Major Murther. Officer Tyler, they are the individuals that keep our community safe over here in District 3. Major Murther is the District 3 commander, and Officer Tyler is the cops officer over here. Public safety is extremely important in this community, and so I thank you for you being here today to recognize that. But today, we are celebrating not public safety. We did that already a couple weeks ago. Today, we are celebrating Dimensions Healthcare and the fact that they are expanding here in Prince George's County, and I'm honored to say that they're expanding right here in Suitland. But one of the things Neil and I talked about is that this is not just about what they're doing in the Suitland community or District 7. This is about the community surrounding Hillcrest Heights, Forestville, District Heights, Council District 6, Council District 8, all of the surrounding communities that can come right here and get health care services close by in their neighborhood. We just took the tour and we saw a wonderful, wonderful rooms of the examination rooms, the dental room, and the great dental and healthcare services that they are going to receive over here today. And I can tell you as an elected leader, yes, public safety is important. Yes, education is important. But when you have the healthcare in your community, when you're suffering from diabetes and diseases and anything that is impacting heart disease, that is impacting our residents, then we truly are not together as a community. We may be safe, we may have the best education, but if we're not healthy, then we can't go on to create the next generation of leaders. Our families are broken, and so I thank Dimensions again for opening a center right here in Suitland. I want to thank them for all the great work that they've done, and I look forward to continuing working with them and partnering with them. As County Executive Baker would say, today is a great day in Prince George's County. I stole your line, so thank you. Am I introducing him? Okay. That was a perfect lead-in to introduce our wonderful county executive, who, as you know, has done a yeoman's job in Prince George's County. And I personally appreciate the the commitment he has made to communities in Prince George's County, underrepresented communities, with this Transforming Neighborhood Initiative. And I know he's probably going to talk about that and why Dimensions opening in the Suitland community in one of his TNI communities is an important milestone for him today. And so I just want to take a moment to ask you all to just please give him a round of applause. It is a great, great joy to work with him. Everybody's not going to get along, but I definitely can call him a friend, and the county is moving in the right direction in the way that we collaborate with him on the county council and his entire team. So can you all give a big round of applause for our county executive, Rashawn Baker.
But as the councilwoman said, you know, I always like to start out, because they write it for me, it is a great day in Prince George's County. So there, I've read it. They should feel. But today truly is a great day. And it's a great day not just because we are opening up this clinic and we're expanding health care in this neighborhood. It is a great day because we started with a vision of how we change Prince George's County, how we look at these areas in this county and turn them around. And as the councilwoman said, it is not just about public safety, because you can't arrest your way to a better community. You can't just educate your way to a better community. You can't just fix streets to a better community. You can't just build buildings to a better community. You can't just have health to a better community. In order to transform neighborhoods, you have to bring it all together. And bringing it all together and bringing every facet of what government has to bear on it, but not just government alone. Bringing in the private sector and the nonprofit sector. And so when you walk through this building today, don't think of it just as a health clinic, as an extension of health care. Think of it as the neighborhood in Suitland, the neighborhoods around Prince George's County, and those 6 neighborhoods that we said we were going to change the dynamics of what they look like. That's what you look at when you walk around this building, because that's what today is. Very rarely does Brad Seaman tell me something's a big deal, because I think everything we do is a big deal. But he said this is a big deal. It wasn't an easy lift. Much of the things that I asked the staff to do is not an easy lift. If it was, I'd do it. And much of the things that I asked the staff to do are not things that have been done before. But they're things that we should do to make the quality of life for everybody in this county better. When the men and women and children walk through these doors, they may not know Brad Seaman's name. They may not know Betty Francis's name. They may not know Pam Creekman's name. They probably will know Dr. Cooper's name. But what they will know is that they were in trouble, they needed help, and it was provided for them not miles away, but around the corner. That's what today is about. And so it is my pleasure to bring the man who quarterbacks our team. I coach it. I think I do an okay job. But quarterbacks it and got us here today, and that's our CEO, Brad Seaman.
Good morning, Coach, and thank you. First of all, Mr. Baker said that I would tell you a little bit about how we got here. And just briefly, when I came to the administration full-time in real early 2011, I got a phone call from Miss Elsie Jacobs there in the back, and invited me over to tour Suitland and learn a little bit more about the needs over here, and had some community members, some people from the faith community that were there, and told us about the access to care issues that they had here. And so through a series of meetings at that time, I actually had Betty's job. I came back and forth over here and visited, learned more. We looked at a couple of proposals to set up clinics here in the building. Actually, there was already a federally qualified health center here, Greater Baden, who has served the community for years, but we needed more services over here. And Greater Baden decided eventually to consolidate their operation over in Capitol Heights and to move over there. And so it left more needs here in the community. And then I got promoted to CAO, and Ms. Francis came on board, and then something really got done. Because I told her about what the issues were here, what we talked to Ms. Jacobs about, some of the things that she tried, that we tried, and what she did was she went to one of our most trusted partners, and that's Dimensions, and Mr. Neil Moore, and began to talk about ways that we could bring Dimensions in over here to help fill the healthcare gap. And over a period of months, and help from Mr. Tom Himmler back here, and meetings with Neil and Dr. Cooper and their financial team, they worked through a solution that brought us here today. I think many of you know that during the same period of time, in July of 2011, we signed a historic MOU with the University of Maryland Medical System, the state, Dimensions, and the county to really help move things forward and begin a shift in healthcare transformation here in the county, because what the county executive told us was to make healthcare a goal for this county, a priority for the county, and that had never really been done before. So we moved ahead and created this partnership, and it's a very special partnership because it brings together a unique blend of knowledge, experience, and academic as well as clinical expertise, which is something that we've really never had work together here in the county. We signed a multi-party agreement. The partnership is a major step forward to expand healthcare in Prince George's County, and today we're here to highlight another step forward as we close gaps in service and increase access to care. But today is not just about this one facility or about the Regional Medical Center, but it's about creating a world-class healthcare system here in Prince George's County that provides greater access to care and will help improve the health status of county residents. It's a system that will address long-standing health disparities that were the subject of much of what the University of Maryland School of Public Health did, and they're things that challenges that we've faced for many, many years. As we said, under the leadership of Betty Hager-Francis and Pam Kriegmer, and also Pam has two colleagues here with her that Mr. Baker didn't recognize, that I will, Gloria Brown, who's our Director of Social Services, and Teresa Grant, who's our Director of Family Services, and some of their staff there in the back, if you can raise your hand, Gordon, Dr. Carter, Elena. They've all worked hard and understand, as Mr. Baker talked about T&I, that all these things work together. And the reason why I told him that this is such a big deal is because this is one of our T&I areas. And we've done a lot of things here. We've torn down vacant and abandoned homes. We've brought economic development here, as Ms. Tolles has prodded us to do that. But now we understand that these things all work together. And economic development, family services, social services, housing, fixing the blight, those are all social determinants of health. And now to bring the clinic in here with Dimensions, our trusted partner, to run the clinic and leverage the investment that we've already made here, also with our public safety people as well, and the great work that they've done together with the team to reduce crime. It is really a huge deal here for Prince George's County today. This will serve to bolster Dimensions as we create a network here in the county that will utilize the hospital, but will also bring outpatient services here to the residents and citizens of Southern Maryland and Suitland. So I want to say I'm very proud of today and the great work that the team did. I hope you all look forward to what you'll get here with Dimensions and with our continuing partnership with the University of Maryland. And congratulations to all of you and the team.
And now expanding his role to be Chief Medical Officer for our system and Vice President of Medical Affairs for Prince George's Hospital Center. Let's hear from Dr. Carnell Cooper.
Thank you, John. Indeed, this is a great day for the Dimensions Health System as well. This is the largest or most significant initiative in ambulatory care that we've done in the past 2 decades. So this is an important venture for us. As John said, I want to summarize what we're actually providing here. And that is really what it's summarized in the name. We're going to be providing family health and wellness. It's anchored by our family medicine program. It's going to be geared towards preventive medicine as well as maintenance of health care. It's going to be including well child care visits, physical examinations, as well as vaccinations. We're going to have a very robust women's health program such things as prenatal care, well women visits, and family planning will be the real basis of it. And finally, we're going to have a very substantial dental health suite. It will involve cleanings, scalings, and excuse me while I cringe when I say the next thing, root canals. On staff to anchor our family medicine program, we have Dr. Savagan. Unfortunately, he's not here today. He has over 10 years of experience and is well recognized in our community. The anchor of our dental program will be Dr. Darcy Bengenia, who's standing over there. Ready to go first? And even though I don't like root canals, I think given what I've known about her, it'll be a pleasure having it done by her. The OB services will be anchored by two midwives as well as physicians who will be here on a regular basis. What makes this center different from other centers is our real focus on prevention. We also, the other thing that makes us different is the ability to be able to have a hospital that will act as a backup, as a referral for these patients. So we will not, their care will not stop here. If their needs expand beyond this, we will have the capability of giving the experts care that we need. The services that I'm telling you about today are only the beginning. As the needs of the community grow, we will expand. We have our eye on some specialty care here, as well as an urgent care center. So we will move, we will change, we will morph into what the needs of the community are. So as I said, this is a very exciting day for Dementia's Health Center. This partnership between the county and the community in Dementia's has grown over the past few years. We only see it growing more in the future. Thank you.
Three,